Hi, my name is Dr. Adam Zuckerman. I'd like to welcome you to my Thyroid Relief website. While you're on this site, you can browse and find a lot of valuable information about your condition. You could even see a spot where you can request a free DVD to learn more in depth about your problem. You'll even learn what makes us unique and why we see amazing results by doing things much differently than other doctors that you've seen. I've been in practice in Boynton Beach, Florida since 2004. I've studied underneath Dr. Datis Karazian, which is the best-selling author of Why Do I Still Have the Thyroid Symptoms When My Lab Tests Are Normal? He's also one of the leading researchers when it comes to thyroid conditions. I also studied underneath Dr. Michael Johnson, who's the author of the book, What Do You Do When the Medications Don't Work? If you're suffering from thyroid problems, especially hypothyroid, I definitely understand your concern and your frustration. We help frustrated patients get better on a daily basis. Some symptoms you may be experiencing with the thyroid problem. Fatigue, you just have no energy. Increase in weight gain, even on a low-calorie diet. You could have morning headaches that wear off as the day progresses, depression, constipation, overly sensitive to cold weather, poor circulation and numbness in your hands and your feet, muscle cramps even while you're resting. You catch colds and other problems easily and you just can't fight them off. Wounds heal very, very slowly. You require an excessive amount of sleep to function properly. Chronic digestive problems may occur. Itchy, dry skin, dry or brittle hair. Hair falls out easily. You get edema, which is swelling, especially in the facial area. You could even lose the outer third of your eyebrows, so you could lose the hair there as well. What your thyroid gland supports, what most people don't realize, is things like bone metabolism, immune system function, your brain and your nerve system, your endocrine system like your adrenal glands, your ovaries, and your testes, GI function or your intestinal tract, liver and gallbladder, growth and sex hormones, fat burning, insulin and glucose metabolism, healthy cholesterol levels. The list goes on and on. Your thyroid gland is extremely important. In fact, every cell in your body has thyroid receptors. It's what we call thyroid crosstalk. Your thyroid talks to your immune system, but your immune system also talks to your thyroid. Your thyroid gland talks to your intestinal tract, and your intestinal tract also talks to your thyroid. Your thyroid talks to your brain. Your brain also talks to your thyroid. Your thyroid talks to your endocrine system, and your endocrine system talks to your thyroid. Every system affects another, so a lot of times when you're still experiencing symptoms, you're actually having problems in other parts of your body as well. Chronic health conditions are pretty much a result of different organ systems taking place and going awry at the same time. So what we found is that all chronic health conditions have some similar threads to them. For example, if you're suffering from a thyroid condition, you can also be suffering from things like insulin resistance, metabolic syndrome, fibromyalgia, vertigo, chronic fatigue syndrome, peripheral neuropathies, radiating pain in your hands and your feet, rheumatoid arthritis, chronic neck and back pain, irritable bowel syndrome, Crohn's disease, celiac disease, infertility and polycystic ovary disease. The list goes on and on. So let's talk a little bit about the thyroid. What I find is when patients come into my office, they know very little about what is actually taking place in their body. So firstly, your brain sends signals to your thyroid through thyroid stimulating hormone. TSH, or thyroid stimulating hormone, causes an enzyme called TPO to stimulate the release of T4, which is an inactive version of thyroid hormone, and T3. In fact, about 93% of the thyroid hormone produced from your thyroid gland is T4, and about 7% of T3. These hormones ride on what we call a taxicab, which is what we call a thyroid binding globulin. T4 has to become an active form, which is T3. So it has to go to other places. So the TBG, or the taxicab, escorts the T4 and the T3 to places like the liver, the gut, peripheral tissues, where T4 is transformed into the active form of T3, then is able to enter the cells through receptor sites or doorways. So in the liver, 60% of T4 is converted to T3. Therefore, if you have poor liver function, that will actually cause poor T4 to T3 conversion in your body. 20% is sent to the gut to be converted. So if you have bad intestinal tract and bad intestinal flora, that will actually cause a poor conversion of T4 to T3 as well. 20% of T4 is sent to peripheral cells for conversion to T3, and a small percentage of T4 goes to reverse T3. Have you been told that your lab tests are normal? I'm here to explain to you that lab ranges are pretty much inaccurate. When you go to a lab down the street, which is what we're all accustomed to, you have to ask yourself the question, when you walk into the lab, who are the people who are typically getting tested? Are they quote-unquote healthy people or sick people? Typically, it's sick people who are getting lab work done on a regular basis. So you look in the corner and you see somebody with chronic anemia. You see somebody with liver failure. You see somebody with chronic health conditions, and these people are repeatedly getting tests. What these labs do to come up with their normal ranges is they take all the data for that are accumulated on patients over time. They plug it into their computer and they come up with a range of high to low. But what you really need to ask yourself the question is if you want to be that healthy individual going into the lab, and you're getting compared to all of the sick people in the population, do you want to get compared to sick people? Because that's what's happening. The ranges that they come up with are actually a comparison from a low end of sick to a high end of sick. And what we focus on in the office is functional values, which means that we're going to keep you healthy in a functional range, and we basically have our own curves and values that we go by. Functional lab values are more sensitive and reveal problems before they're even seen on traditional labs. So we want to keep you healthy. We don't want you walking down the path of disease on either end, too low of something or too high of something. So for example, TSH. In my office, I'm not happy unless you're at 1.8 to 3.0 when it comes to that value. In most labs, they're happy if you're 0.45 to 4.5. That is a humongous range. Once again, we want to keep you healthy in the center of that bell curve that they created based upon sick people. So what type of tests are typically ordered when it comes to the thyroid? Typically, you get TSH, which is a thyroid stimulating hormone. And if you're lucky, your doctor will also look at total T4. Compare this to what we call our true thyroid functional test. We obviously check TSH and T4, but what about the free thyroxine index, the FTI? That's the total amount of T4 that's available. We look at free T4. We look at T3 uptake. How much of T3 is taken up by those TBGs, those taxi cabs? We look at free T3. We look at reverse T3, the T3 that the body can't use. We look at your TPO and TBG antibodies, which are indicators of Hashimoto's disease, which is an autoimmune problem that we'll talk about shortly. We look at TSH antibodies for Graves' disease, once again an autoimmune problem. And we look at TBG levels, those taxi cab levels. Typical thyroid tests ordered, once again, are TSH or total T4. We look at about 10 different tests to see what is happening when it comes to the thyroid function and the thyroid mechanism. I look at it from the standpoint, how on earth can you possibly manage your health without all of the information? To manage your health, you need to look at causes of the problems, not just the symptoms. Managing symptoms is just what it sounds like, managing symptoms and how you feel. The current treatments for thyroid, despite newer medications coming out on a regular basis, is actually a 50-year-old model. In fact, a Journal of Endocrinology and Metabolic Disorders in 1998 stated that 80% of hypothyroid patients are actually autoimmune. And that has been supported in the literature throughout the years. It's not just a 1998 study, which means if you're autoimmune, a majority of cases of hypothyroidism are autoimmune. When is the last time that you actually were checked to see how your immune system is actually functioning? And that's one of the key things that we do in our office. Hashimoto's disease and Graves' disease, these are not primarily thyroid problems. Your immune system is mistakenly attacking your healthy tissue, your TPO and your TBG antibodies, and the enzymes rather, through Hashimoto's, or your TSH for Graves' disease. These are immune system problems. There's an imbalance in your immune system that needs to be addressed. How do we know? We need to do proper testing. So why would your immune system attack your own body? This could result from things like chronic inflammation from anything that can take place in the body. Things like poor blood sugar, if you're a diabetic, bad adrenal glands with cortisol levels, hormone imbalances, neurological imbalances. How do we know? We have to do proper testing. How do we help thyroid issues in our office? First, we remove the antigens or the causes of the dysregulation in your body. We modulate and balance out the immune system through our nutritional support and supplementation. We support your immune system. Thyroid dysfunction is a sign of metabolic dysfunction, so proper testing is crucial, and that's why I keep repeating proper testing. What we look for is we look at a complete metabolic profile, which will include a complete thyroid panel like we discussed earlier, including the thyroid antibodies. We look at vitamin D levels. We look at anemia and kidney function. We look at immune panels to check for your Th1, Th2, which are your T cells and your B cells, to see if they're balanced out. We look at cortisol levels through an adrenal stress index through a saliva panel. We look at food sensitivity, the four main things when it comes to food sensitivity and autoimmune conditions according to all of the medical literature: gluten, soy, dairy, egg. We want to test for these things. We want to look at stool microbial to see if you have any parasites or underlying gut infections that would actually alter the function of your intestinal tract. So what makes our office different from every other doctor that you've seen? I'm here to tell you tonight that we will leave no stone left unturned to determine the exact cause of your condition. Based on lab findings using functional values, like we stated earlier, our nutritional products are designed to help support the biochemical pathways for healing in your body. We will look at the gut. We will look at the thyroid and adrenals. We will look at your liver and your biliary system. We will look at anemias, sugar regulation, autoimmune regulation. Remember, these are all the thyroid crosstalk that we were talking about earlier. If these things talk to your thyroid, it's essential that we see how they're functioning. So, first 2 visits in our office. On the first visit, what we do is we do a complete exam and neurological evaluation, and we review all of your existing labs. So we would like to get notes from every doctor that you've been to, and also all of the labs that you've been through through the years, so we could get a feel of what's going on with you. On visit 2, we're going to review your case and we're going to overview to see if you actually qualify for care in our office. So once again, visit 1, we're going to review your whole entire case and ask questions, spend time with you to figure out what is potentially going on. And on visit 2, we're going to go through the results of our exam and consultation on visit 1, and then we're going to figure out if we can help you and how. So what you need to ask yourself the question is, on a scale of 1 to 10, how serious are you how serious are you to resolve your illness? How has your illness affected your relationships with your friends or your family members, your children, your parents? What about work? How has it affected your ability to enjoy your life? On a scale of 1 to 10, how serious are you about getting rid of it? And what you have to understand is we are here to stop your suffering. There is a solution. We are here to add value to your life. I hope you learned a lot, and remember, you can still request a free DVD for more information. I look forward to hearing from you soon.